I am Yahya Disu, the Head of Risk Communication and Community Engagement for Nigeria Center for Disease Control and Prevention, and the lead for the Nigeria Infodemic Management team. I'm presenting Nigeria experience of using insights generated from social listening data by our infodemic management team. What we do is to collect social data from different sources. And one of those sources is our event-based surveillance system, polling and surveys, digital listening using media toolkits, and some other software, community polling, focus group discussions, and feedback from the community. All these data are translated to generate insights. We actually started by leveraging the event-based surveillance system in NCDC to gather communication surveillance information like misconception, misperception. And then NCDC had Tatafo, a homegrown software for mining data from digital platforms. And then later we started using social media toolkit to mine from directly by communication team from digital platforms like websites, Twitter, Facebook, and so on. And during COVID-19 pandemic, we commenced pollings, telephone pollings, and surveys to understand perception of the people, the confidence they have in government, the knowledge, and so on, to be able to enable us respond to their information needs, and then to also inform strategies. And then lately, we started doing community polling, and then using focus group discussion as well as community feedback to generate feedback and insight from the community. So data from different sources are currently triangulated to generate insight for our data analysis team and to inform decision making, and then also ensure dynamic messaging and communication strategy, and then also systems and tool development, and then training programs, development and implementation. How we've been able to do this is through development of infodemic management guidelines for the country that we use at all levels, and also establishment of infodemic management framework. We have Nigeria infodemic management at national level, and we also have the same at the sub-national level in each state. And we need to leverage collaboration with partners, government MPAs, and partners as well as academia that were able to ensure the success of this program. So capacity is also built at all levels to ensure efficiency and contribute innovation and the use of data and for generating insights. And then also we need to develop social media strategy for us to be able to take advantage of digital platform for listening to community as well as providing the necessary information they require to inform positive behavior adoption. So for results, the Presidential Task Force was guided in implementing the COVID-19 protocols through the data we are getting from the police. And then even the realization of the protocols were also partly informed by results from the polling in addition to the epidemiological data. Then our communication strategy that evolved was also based on insight we are getting from the transmission of the data. And we continue to adapt our strategy and then the theories, the models we were using. We started with the crisis communication using a belief model. Then later, precautionary advocacy, we started using and we changed to EPPM model. And then later, we moved to routine health education. And then when the vaccine arrives, using addiction theory, socio-ecological model, and so on. And then for system and tools development, we're able to develop sub-national infodemic management system and to enhance capacity of the community to be able to listen, analyze, generate insights, and also take necessary action and then also document this and report this to the national, where we put everything together to understand the national perspective of infodemic landscape. Then we're able to also, based on the information we are getting from the pollings and the social listening, to develop empathy and trust building tool for healthcare workers. We noticed people trusted healthcare workers during the pandemic, but then when the vaccines arrived, because of low confidence in the vaccine by healthcare workers, they were not also communicating appropriately. So we were able to use this opportunity to develop the tool to address this gap by improving the confidence of the healthcare worker, ability to empathize with the patient. And then, of course, in addition to other interventions, the vaccine uptake started improving gradually. And the last is designing our training programs. The feedback from interventions, infodemic management interventions in the community, also showed that we needed to build their capacity to be able to use social media for public communication to inform behavioral change. And that is also going on in many of the states, about 12 states of the Federation. Then due to funding that we got from Global Fund and support from other partners like Breakthrough Action Nigeria, WHO, UNICEF, and so on. And then also ICAP is also supporting this. And then recently we launched our media EIS fellowship program. And this is a training program to empower the media to be able to report accurately and then also understand technical information and, more importantly, translating to understandable narrative to the members of the community. In addition to that, they should be able to report in a way that can inform behavioral change. And that's what the EIS stands for: epidemiology, infodemiology, and social behavioral change communication. So, considering all this, we feel the use of insight from infodemic management has gone a long way in contributing to global health security. This is showing the rumor log and then the media monitoring logs, how we collate and collect and store our data that are prepared for analysis. And then you can also see